Desmopressin, also known as DDAVP ampule, is a medication used to control the amount of urine your kidneys make. It helps to replace a low level of vasopressin, a substance in the body that normally controls the amount of urine you make. This medication is used to treat conditions such as water diabetes, diabetes insipidus, certain kinds of head injury or brain surgery, and helps to control increased thirst and too much urination, preventing dehydration. In addition to controlling urine production, DDAVP ampule is also used to control bleeding caused by surgery or injuries in people with certain bleeding problems, such as hemophilia A and type 1 von Willebrand's disease. It works by helping the body with normal blood clotting. The daily dosage and optimal timing of DDAVP ampule will depend on the individual's condition and should be determined by a healthcare professional. If you have any concerns about taking this medication, be sure to consult with your doctor for their professional guidance. When using DDAVP ampule to control bleeding, it will be administered by a healthcare professional through an injection into a vein, typically over 15 to 30 minutes. If DDAVP ampule is being used to control increased thirst and excessive urination, it will be given by injection into a vein or under the skin as directed by your doctor, usually twice a day. If you are administering this medication at home, be sure to carefully follow the preparation and usage instructions provided by your healthcare professional. It's important to use this medication regularly at the same times each day to get the most benefit from it. Before using, visually inspect the product for particles or discoloration, and do not use the liquid if either is present. Be sure to learn how to safely store and discard needles and medical supplies, and consult your pharmacist for more details. It's important to limit the intake of water and other fluids while using this medication, especially in children and older adults. If you find that you are drinking more fluids than directed, it's crucial to inform your doctor right away, as your treatment may need to be adjusted. The dosage of DDAVP ampule will be based on your medical condition and response to treatment, and it's essential not to use more desmopressin or use it more often than prescribed. Be sure to inform your doctor if your condition does not improve or if this medication stops working well. Side effects of DDAVP ampule may include headache, nausea, upset stomach, flushing of the face, or redness/pain/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Rarely, desmopressin may affect your blood pressure, causing an increase or decrease. A temporary drop in blood pressure may lead to dizziness and a fast heartbeat. Speak to your doctor for more details, especially if you have heart problems or high/low blood pressure. Notify your doctor promptly if changes in blood pressure occur or if any of these symptoms occur. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. A very serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Remember to take this medication as prescribed by your doctor and at the recommended time for best results. Desmopressin, also known as DDAVP ampule, is used to control the amount of urine your kidneys make. It helps to prevent dehydration and electrolyte imbalance in people with certain conditions. It's important to be aware that desmopressin can rarely cause a low level of sodium in the blood, which can be serious or even fatal. Factors such as drinking too much liquid, using certain medications, being 65 years or older, or having certain medical conditions may increase the risk of low sodium in the blood. Before starting this medication and while using it, lab tests such as urine tests and sodium blood levels must be done. If you experience symptoms of low sodium in the blood, such as nausea, vomiting, headache, muscle weakness, unusual tiredness, dizziness, or mental/mood changes, it's important to inform your doctor right away. Seek medical help immediately if you experience any very serious side effects, including seizures or trouble breathing. The dosage and timing for taking DDAVP ampule should be determined by your doctor, and it's important to attend all medical and lab appointments. Before starting treatment with DDAVP ampule, make sure to inform your doctor or pharmacist about any allergies you may have or if you have a history of kidney disease, high or low blood pressure, heart problems, or conditions that may increase your risk of fluid/mineral imbalance. If you become dehydrated, your doctor will correct that condition first before starting treatment with DDAVP Ampule. This medication may cause dizziness, so avoid driving or using machinery until you can do so safely. Limit alcohol consumption and talk to your doctor if you are using marijuana. Tell your doctor right away if you develop any illness that can cause water/mineral imbalance, or if you experience conditions that require drinking more fluids. Before having surgery, inform your doctor about all the products you use. Children and older adults may be more sensitive to the side effects of this drug. During pregnancy, use this medication only when clearly needed and consult your doctor before breastfeeding while using this medication. When taking DDAVP Ampule, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with DDAVP Ampule include tolvaptan and water pills or diuretics such as furosemide. Be sure to discuss any concerns with your healthcare provider to ensure the safe and effective use of DDAVP Ampule. If someone has taken too much DDAVP Ampule and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include severe or persistent headache, confusion, drowsiness, and sudden weight gain. Never share DDAVP Ampule with others. Your doctor may conduct lab tests and medical exams while you are using this medication, such as urine tests, blood tests, blood pressure, and pulse checks. Make sure to attend all scheduled medical and lab appointments and consult your doctor for more information. If you forget to take a dose of DDAVP Ampule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store DDAVP Ampule in the refrigerator, but do not freeze it. Keep all medications, including DDAVP Ampule, away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When DDAVP Ampule is expired or no longer needed, be sure to properly discard it. Consult your pharmacist or local waste disposal company for more information on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.